Because of the fact that I had ongoing treatment after surgery, I had the radiation therapy, then I had chemotherapy. I had surgery the very last day of 2008, and I did not have the implant, both the implant for urinary incontinence and also for the penile prosthetic, until March of the next year. So it was 15 months for me. Now I would kid anybody by telling them you're going to be exactly as you were when you were 20, 25 years old. That's not going to happen. That's not going to happen to anybody who's considered normal either. I mean, you're not going to be that way, but it gives you a lifestyle back. Sometimes I'm in the car for a couple of hours, sometimes 3 or 4 hours, and I can do those trips with a 16-ounce soft drink, diet drink in my car, and I can go across the state without having to stop for the restroom. I'm also a tour guide at a museum. I can do that kind of work. If I did not have this surgery for the incontinence control, I could not do that. There's just so many things that we can do together now, whether it's bike ride or go to a movie or swim in the pool or whatever, that was temporarily taken away from me that I've got back now, and I appreciate the fact that the technology exists where I can have that back.
And that's my thoughts too. I feel so fortunate that we are in a world where we have these options, that this technology exists to help quality of life issues. So it's a joint decision, it's a couple's problem, and when Barry did this, I felt like he was doing it just as much for me as he did it for himself, and it's life altering. So I would say, if you have quality of life issues and this can fix it, then you shouldn't hesitate. It was an easy surgery. Of course, that's easy for me to say, but it truly was. He was a really easy patient, and recovery was fast, and I can't say enough how much of a difference it's made in our lives.
Looking back on the procedure now, I find in many ways my life is better. I'm more comfortable with things now even than before the prostate cancer. It kind of puts things in perspectives about how precious life is and how there are options to assure that that can continue beyond an age where a lot of people would say, oh, well, I've had a good run, it's now time to hang up my spurs or what have you, and just deal with it. Nobody has to deal with it. You know, medicine has got to the point where these things can be addressed and fixed, and you can continue to live years beyond, not only vertical and upright, but also with functions intact, whether it's the ability to go to the bathroom when you want to go to the bathroom, and the ability to have a rewarding, fulfilling sexual lifestyle with your spouse in a normal way that you've grown accustomed to.